Hello and welcome to this bonus episode of the Fertility Podcast, where I've been taking some of the best bits from Fertility Fest to give you a short series of abridged versions of some of the sessions that took place. The Miscarriage session brought the subject out of the shadows and into the spotlight with the whole evening dedicated to what might have been. This episode starts with visual artist Foz Foster, who is determined to challenge the perception that miscarriage only happens to women. And he is talking about his extensive body of work, Labour of Love, celebrating the 3 children he lost, including his epic 76-foot-long scroll, Pain Will Not Have the Last Word. Following Foz, you'll hear a reading by Julia Bueno from her new book, Brink of Being. Julia is a counsellor and psychotherapist with a particular interest and experience in working with clients who struggle with their fertility or have lost a baby at any gestation of pregnancy. She's also been a support worker and trustee of the Miscarriage Association, and recently she paused the research for her doctorate to write her book, The Brink of Being, which has just come out.
Me and my wife never really discussed our miscarriages because I don't think either of us had anything to say to each other which went beyond the obvious pain that what we were both going through, which seems quite bizarre now, having spent 2 years drawing a picture and lecture about it around the country. It's noteworthy that no newspapers would discuss the work. We tried for 6 months. It seemed it was a double whammy. The taboo of miscarriage and men and miscarriage was too difficult or deemed not newsworthy, which is tragic and also very shocking. However, on the morning of the London show, the miscarriage work was installed. The journalist rang me to say The Guardian were doing a large piece on it, which was great, finally. However, I'm sure if Jessica had been on it, they would have probably submitted straight away. This was taken from the Esra, Barcelona last year, which was an incredible experience on lots of levels for me because it was the first time that I'd seen the scroll in one piece. Esra was the first time, I can honestly say, where the audience actually really looked carefully at the work and would come up to me and say, "Can you talk to me about that little centimetre bit there?" And I was going, "Yeah, can I remember that?" But yeah, it was fantastic and a real privilege to actually discuss the work properly.
As I know so well, miscarriages often give permission for the telling of other miscarriage stories. Like many women having children 30 years ago, Lucy's mother hadn't talked about what had happened to her with friends or family, nor shared her feelings of grief with anyone apart from her husband. The pressure her mother felt back then to put up and shut up was more intense than what she perceived to be the case for women today, and Lucy was left with no conscious inkling of her sibling-to-be. However, witnessing her and supporting her daughter's experiences reawakened the memories of this past loss. And Lucy came to learn the story of another family bereavement that, like her own, would never quite find its bearings. Lucy had never known that for most years, while she was growing up, her mother had privately remembered both the date of her miscarriage and the date she'd hoped to give birth to a sibling for Lucy. Neither had her younger sister, born a year after this due date. But in more recent years, emboldened by pregnancy loss awareness campaigns, Lucy's mother had bought flowers for the kitchen table to mark her lost due date, but only ever told Lucy's father why. Lucy told me how much she appreciated her mother's candour, as she did other women's too, and how the shared grief supported her. She vowed to talk more to her mother about her experience, not wanting the topic to disappear again.
It's incredibly moving work that you're hearing, and I will be putting details of where you can find support if you're finding any of what you're hearing hard to hear at the end of this episode. Now we're going to move on to the panel discussion, which brought together Julia Bueno, who had been talking about her new book. She had done a reading. The book is called The Brink of Being. Also, writer Lisle Turner and director Claire Coache from theatre company Open Sky, who'd presented a scene from their new show Cold, which is a story of a pregnancy that doesn't go to plan. Ruth Bender Atick, who is the National Director of the Miscarriage Association, was also on the panel, as was David Ogutu, Medical Director of the Herts and Essex Fertility Clinic. The panel was chaired by Kate Bryan, Women's Voice Lead at the Royal College of Obstetricians and Gynaecologists, and we join Kate now.
One of the things you said when you were speaking which was really quite overwhelming was when you were talking about the reality of a miscarriage and about the blood and describing it as being like a Tarantino movie. And Julia, you talk about that quite a lot in your book as well. And you two just let us see that. Was that difficult for you to actually put on stage?
It was all pretty difficult to put on stage, to be honest. Yeah, I mean, we had lots of discussions about how to best represent it. We considered actual blood, but then within the sort of language that we were creating, this kind of transposed fairy tale, our designer, Tina, actually came up with a proposition of using the red fabric. And once we started playing around with that, then it kind of evolved from there. And we had the kind of active discussion of like, how much can we show? And it's like, well, actually, that was a bit of red fabric, and it felt quite shocking to see. Yeah. It's still nothing like what actually happens, or what, you know, in our experience. I haven't been present for anybody else's, but it was like a Tarantino movie. It was. So yeah, I don't know. I mean, in this context, I think people. I don't know yet what another audience will make of it, but we certainly don't want to put any. We won't be putting any less on stage. Yeah.
Ruth, do you think that's one of the things that people are just completely unprepared for, is the reality of what happens with miscarriage, particularly when people are just told to go home and miscarry?
Well, yes. I mean, unfortunately, it's not uncommon for people to be told it's going to be a bit like a heavy period and it might be a bit painful. And I guess that might be true for some women, but you know, I've had men who've described it as, you know, it looked like a scene from a horror movie, exactly as you're talking about. It looked like a war zone. And actually women often too, because as women, if you're used to using tampons when you have your period, you're not even used to seeing menstrual blood, and this tends to be a whole lot more. So it can be very, very bloody and very, very painful. And yet when women describe it as it was like contractions of labour, sometimes health professionals poo-poo that. And I, as I say that, I don't want to make a sort of us and them, because it isn't like that. Because health professionals also include people who have miscarriages, and it's horrible. But it is difficult. People don't know what to expect, and it can be very, very frightening for the woman and for her partner, whether that's a male or a female.
David, as a doctor, you know what's going to happen to your patients, but do you find it quite hard to talk to them about the reality when you know that they're going to lose a baby?
It can be difficult because, you know, you've given an awful diagnosis to start with, so it's dealing with the diagnosis and then the aftermath. And if you have 10 different patients, they'll all have 10 different reactions and 10 different expectations and 10 different wishes as to how to manage the miscarriage. So some patients would just want to be out of that clinic as soon as possible. There would be those who would want to have a surgical procedure because they don't want to experience it, and it's a matter of having the time and the opportunity to provide all the different options in terms of what are the different options of managing the miscarriage, be it surgical, medical, or just go home and wait and see. There's pros and cons to it. Surgery could be easy for some because you go to sleep and you wake up and it's all done, but it's got its risks and complications. It may be a wait to get to it, so it takes building that rapport and spending the time to get to have a feel of what the patient would like, and or most importantly, asking what they would like, or giving them the time to maybe leave the clinic if they want to leave the clinic as soon as possible, and call back to say we thought about it and this is what we want. But it can be difficult because at different gestations you're going to have different experiences as well.
Julia, one of the things that you talk about quite a lot in the book that is another often really difficult thing for people is the fact that no one tells you anything about why it's happened, and no one wants to investigate why for a long time. And I think that seems to be just so difficult to send someone away and say, we can't tell you anything more than that. Is that something that you think we really ought to do more about?
Well, that's probably something more for Ruth, because I know some of the charities involved with the kind of research and the issue about investigations after 2 or 3 miscarriages, that a lot of couples now still have to wait to have 3 miscarriages before they have investigations, and there is debate about that, of course. But my response to the not knowing, not having answers is that what I deal a lot with is that I see more women than couples to talk about this issue, that women turn in on themselves, and a very common response to the void, which I think women do anyway regardless of miscarriage, is to blame themselves, and that's very corrosive.
Ruth, is that something you see quite often?
Yeah, I think so, and again, I think it can be partners too. Men will say, "Well, there must be something wrong with my sperm. I seem to manage to get her pregnant, but there's something the matter with the babies." But I think we're also talking about living with uncertainty. Living with not knowing whether to try again, or if you try again, and how hard that can be if you've been through the fertility journey, because it's just not that easy to try again. But also how do you enter another pregnancy when your previous experience has been a loss? How do you enter it with hope? Does that make sense? Is it much better to assume that it's going to go horribly wrong? And you're dealing all the time with that uncertainty. And as you say, Julia, when you don't have an answer for why it's happened, we will invent one. It'll be something we did, or something we didn't do, or something we thought. And that's very, very difficult.
Do you want to come back on
that? I've heard some kind of amazingly creative and extraordinary things that women will blame themselves for, whether it was sort of leaping too hard on a tennis court, or standing too close to an oven, or too close to a fridge, or feeling very stressed or angry that day.
If you have any questions about anything that was discussed in this episode, please do visit the show notes, which are thefertilitypodcast.com/the M word. There I'll put details of the panel and how to get in touch with the Miscarriage Association. You'll also find the details of the Fertility Fest website, so you can keep up to date on what happened at the festival, as well as the other episodes that I've made in this series. Finally, be sure to subscribe to thefertilitypodcast.com. You can sign up to my email newsletter to make sure you don't miss an episode. And you can search for previous episodes, including other conversations I have had about miscarriage. Thanks for listening, and until the next time.